Alright, so random pharmacy things part 2. Plan B does not interact with alcohol. I saw a TikTok going around a while ago saying that alcohol decreases the effectiveness or efficacy of Plan B. That's cap. Some medications that do interact with progestin-only pills are your 3A4 inducing drugs. So phenytoin, phenobarbital, and primidone, oxcarbazepine and carbazepine, rifabutin and rifampin, St. John's wort, modafinil, and higher doses of topiramate. Speaking of Plan B, it may be less effective if you're greater than 165 pounds or have a BMI greater than 25. Another emergency contraceptive called YOUR.FAV.PHARMACIST, it's by prescription only. Some studies show lower efficacy at greater than 195 pounds and a BMI of greater than 30. Fun fact, YOUR.FAV.PHARMACIST is actually an abortifacient and can cause abortions at high doses. The only emergency contraceptive that's not affected by weight is the copper IUD or Paragard. Another random pharmacy thing is that if you can't swallow Vyvanse capsules, you can open it up and sprinkle it onto food or into water. Another random pharmacy thing is you can put eye drops in your ear, but you shouldn't put eardrops in your eye. Another pharmacy thing, it's recommended to take Xarelto 15 and 20 milligrams with food to increase bioavailability. Not really a pharmacy thing, but something we learned in anatomy is babies have more bones than adults. Some of their bones fuse into larger bones as they age. Another random pharmacy thing, the over-the-counter drug loperamide or Imodium used for diarrhea is actually an opioid. It's peripherally acting, but can cross the blood-brain barrier and get into the CNS when taken in excess and or with enzyme-inhibiting drugs. Abusing loperamide is dangerous and can cause cardiotoxicity. Supratherapeutic doses can cause ventricular dysrhythmias and QRS and QT prolongation. Another random cool pharmacy thing is testosterone gel is flammable. Androgel contains 67% ethanol. I think that's cool. So make sure this dries before going around like a fire, an open flame, or before you smoke. Another interesting pharmacy thing is the antipsychotic Latuda, lorazepam has to be taken with at least 350 calories. Administration with food increases the area under the curve of the AUC by about 2-fold, and then it increases the Cmax by about 3-fold. Another benzisothiazole derivative antipsychotic, ziprasidone or Geodon, also needs to be taken with food, at least 500 calories. Another random pharmacy thing is if you're on aspirin and ibuprofen, which I've had a few patients on both, you need to take the aspirin at least 30 minutes before you take the ibuprofen. Timing is important when trying to preserve the cardioprotective effect of the aspirin. Aspirin irreversibly binds to COX enzymes via acetylation. It forms a covalent bond. Because of this irreversible inhibition, the antiplatelet effects of aspirin can last days after your last dose, for the life of the platelets.